Hi, good evening everyone. Welcome to Health and Science. Today we are going to talk about thrush, medically known as candidiasis. Thrush is a fungal infection caused by a family of yeasts called Candida. Over 20 species of Candida can cause infection. However, the most common responsible species is Candida albicans in about 90% of cases. Most of the remaining cases are caused by Candida glabrata. Candida are usually present on our skin, in our guts, mouth or private parts in small quantities. Most of the time, these yeasts or fungi are harmless. They only become a problem when they overgrow. An overgrowth of Candida can lead to candidiasis of the mouth, throat or private parts. There are different types of candidiasis. When the Candida overgrow in the mouth, it will lead to oropharyngeal candidiasis, or also known as oral thrush. When the yeasts spread in the vagina, it is referred as candidal vulvovaginitis and vaginal thrush. Unfortunately, women are more infected by yeast's infection than men. It is estimated about 75% of women will have vaginal thrush in their lifetime. The other type of candidiasis is when yeasts enters the blood and spread to other parts of the body such as spleen, kidney, muscles, eyes, bones, heart, brain, and this is called invasive candidiasis. Now let's look at why thrush can affect both men and women but is more common in women. Well, if you study the nature of the Candida or yeast, you will find Candida-like moist environments. Candida fungi thrive and grow in warm, moist areas. This is why the condition often affects areas where there are folds of skin. Candida can live harmlessly in some parts of the body, but can sometimes multiply and cause symptoms. Candida skin infection can cause intense itching, growing skin rash, swelling, or inflammation. Men can also become affected by thrush. The medical term for the thrush affecting the male genitals is candidal balanitis, inflammation of the tip of the penis. There are many causes of balanitis, but a candidal infection is the most common. Babies can also get candidiasis of the skin, especially on the buttocks. A diaper tends to provide an ideal environment for Candida. That's why it's important to change your baby's diaper as soon as they wet or poo themselves. What are the symptoms of Candida infection? The classical presentation of oral thrush may include 1. Creamy white lesions on your tongue, with a cottage cheese-like appearance. The condition can quickly become aggravated and cause mouth pain and redness. 2. Loss of taste or an unpleasant taste in the mouth. 3. Redness inside the mouth and throat. 4. Cracks at the corners of the mouth. 5. A painful, burning sensation in the mouth. 6. In severe cases, you may experience difficulty eating or swallowing. 7. A band of gum irritation or inflammation. 8. Soreness or sensitivity to acidic and spicy foods, an unpleasant taste in the mouth and bad breath. Thrush in women. Now let's examine how and why overgrowth of Candida happens. Candida albicans are shapeshifters. When pH of private parts increase and there are fewer microbes to compete with, Candida overtakes the normal flora of the private parts and spreads using their hyphae forms. They multiply and spread in large numbers, causing colonies around the areas. What can trigger thrush or Candida infections? Or what can make you more susceptible to Candida infections? 1. Having diabetes. 2. Having cancer. 3. Taking too much sugars. Too much sugars can make your immune system to become suppressed and unable to ward off any bad bacteria and fungus, therefore allowing yeasts to thrive. 4. Stress. 5. Taking antibiotics, lower competing bacteria, and this will allow Candida to take over. 6. Also, when the immune system is down or compromised, the body may be incapable of controlling Candida overgrowth effectively. So, in other words, candidiasis can also be an opportunistic infection. 7. Using steroids is another risk factor. Patients using inhaled or topical steroids can cause localized immunosuppression. 8. Malnutrition. Malnutrition or a diet lacking in one or more nutrients can impair the production and activity of immune cells and antibodies. Consequently, compromises our body's defense mechanisms, and make a person more susceptible to infection. Invasive candidiasis has various causes. These may include 1. In hospitalized patients, it can be caused by contamination through instruments or when healthcare workers don't wash their hands properly. 2. Long-term or repeated use of broad-spectrum antibiotics which target many different kinds of bacteria in the body, and depletes your gut bacteria and weakens your defenses against Candida. 3. Candida can enter your bloodstream if you've experienced damage or inflammation of your digestive tract lining, gastrointestinal surgery or puncture, or had central venous catheter inserted into your arm or hand. 4. A weakened immune system due to treatments like chemotherapy or steroids enables Candida to invade your organs through the bloodstream. Last, how do we diagnose thrush or Candida infection? Your GP will collect a sample and send it to microbiology where it will be examined for Candida growth. The sample is cultured on a Sabrous plate, and if Candida is present, it will grow as a white colony. Wet prep can also be prepared using potassium hydroxide, and sample is added to it. Candida albicans will look oval shape, with or without hyphae. Treatments depends on the type of Candida. Oropharyngeal candidiasis can be treated with topical or oral antifungal such as nystatin or severe infection fluconazole. Esophageal candidiasis is normally treated with systemic antifungal therapy such as oral fluconazole. Genitourinary candidiasis is normally treated with topical or oral antifungal such as clotrimazole. Thank you for watching. I hope this video can be a benefit to you or your family. Please subscribe to my channel so you can watch more new educational videos. Stay safe and stay healthy. See you next time.